Nice to meet you. My name is Dr. Matt. How are you? Okay. So you have an appointment. Can you please verify your first and last name? And your date of birth as well. Okay, so I found you in my system. Unfortunately, we did not have an appointment scheduled, but we can go ahead and squeeze you in. Would that sound okay? Alright. So go ahead and tell me a little bit about what's going on. What brings you in today? Okay. I see. And how long ago did this happen? Okay. Do you mind if I type this down as you explain a little bit? Okay. Did you lose consciousness? No. Okay, go ahead. Keep telling me. Any history of headaches? Yeah, okay. How often are they? Okay. So, in the morning and evening. Okay. Do you have any high blood pressure? You're taking medicine for it? Okay. How many milligrams of metoprolol? Is it once a day? BID? Okay. Are you taking any other medications? No. Okay. Do you have any allergies? Mm-hmm. Okay, so you're allergic to pollen. Oh, great. No medications, correct? Great. Okay, I'm going to ask you a few questions. Most of them are going to be neurological. Have you noticed any rhythmic movements of your eyes? No. Okay. Any metallic taste in your mouth? Sometimes. And have you noticed any twitching around your mouth? Okay. Any changes in your smell? Sometimes you can smell smoke. Okay. Well, it might be related to your headaches, but also I would definitely want to make sure that I am, excluding any other reasons. Mm-hmm. Okay. And do you have any problems with your hearing? Do you have any buzzing or any high or low pitch sounds that come and go? Okay. Okay, let's go ahead and type this down. Good. High pitch. Okay. And have you noticed any trembling, any abnormal sensations in your fingerprints, in your fingers or your toes? No. Okay. Any tingling sensations anywhere else in your body? No. Okay. Good. Okay. So, since you're here and we have a lot of time, I'm going to go ahead and let you know that this session is going to take about 1 hour, plus or minus. So let's go ahead and begin your timer. going to take your vital signs first. Let's see. Peel back here. And this is going to go underneath your tongue. Go ahead and open wide. Just hold it, please. Good. Okay. 99.3, that's perfectly normal. Did you have anything warm to drink before you came in? You had a hot tea? Okay. So that explains why it is a little bit high. I'm going to put this on your index finger. Okay. This is going to measure your oxygenation. You can go ahead and breathe normal. Okay. Oxygenation is 95 percentile on room air, and your heart rate is 103, a little bit elevated. Okay. Good. All right, I'm going to go ahead and listen to your lungs and your heart to make sure that I'm not hearing any abnormal sounds. Okay. This is going to go on your chest right here on your left side, and I'm going to listen to your heart. You can go ahead and breathe normal. Good. Good. Okay. So far I can hear only S1 and S2, no S3, no S4. Okay, I'm going to switch to the bell from the diaphragm, and I'm going to listen for any murmurs, okay? Okay. Go ahead and relax. Good. Good, 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 good. Okay. Okay, so I could not hear any S3 or S4 and no murmurs. Now I'm going to switch back to the diaphragm, and I'm going to listen for any abnormal breathing sounds. So now it's your turn to deeply breathe in and breathe out, okay? So go ahead and take a deep breath in and breathe out. Good. And again, take a deep breath in and breathe out. Good. And one more time, take a deep breath in and breathe out. Okay, and I'm going to listen to your back as well. Go ahead and take a deep breath in and exhale. Good. And again, take a deep breath in and exhale. Okay, wonderful. So I could not hear any wheezing, no crackles, no wheezing, no crackles. Okay, breathing normal. Okay, and S1 and S2, no S3, no S4. Perfect. All right, let's go ahead and take your blood pressure. I'm going to go ahead and use your left arm if that's okay. Can you pull up your sleeve, please? Thank you. Okay. Okay, go ahead and recross your legs for me. Good. relax, please. Good. And write your blood pressure in 125/76. That's totally normal. Now I would like to start this examination by doing a physical exam of your head and your face. I'm going to check for any asymmetry, for any lumps or any tenderness, okay? So go ahead and relax. I'm going to just palpate your head and just to see if I am noticing any asymmetry, which is very important. Okay. Any tenderness here in the back, or here. Okay. So I'm not feeling any lumps. Head is symmetric on both sides. And I'm going to go ahead and palpate your face. Any pain as I'm doing this? Just some sensitivity, only on the right side, okay? Any pain around your jaw? I'm going to go ahead and palpate your sinuses. Any pain there? And above your eyebrows. Good. Okay, perfect. Okay, wonderful. So I'm going to go ahead and check your facial sensation. I have a few tools here that are going to allow me to evaluate your face and if you are experiencing any kind of loss of sensation. So first I'm going to go ahead and do a cold test. I'm going to need you to tell me every time I touch your face and tell me if it's left or right. Okay. Go ahead and close your eyes. Thank you. Right. Left. Good. Middle. Good. Good. Right. Good. Left cheek. Right eye. Left eye. Good. Okay, perfect. Okay, now what I'm going to do is I will perform a sharp or dull test. So I'm going to show you exactly what I mean by that. Can you please extend your palm? Great. Alright, so this is what dull will feel like. Good. And this is what sharp will feel like. Okay, perfect. So I'm going to have you close your eyes again and tell me if you feel sharp or dull. Thank you. Sharp. Dull. Sharp. Sharp. Dull. Good. Sharp. 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 Dull. Good. Sharp. 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 Dull. 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 Very good. Sharp. 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 Dull. 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 Okay. Perfect. Okay, now I'm going to go ahead and do the same thing, but the level of intensity is going to be a little bit elevated. This is what sharp is going to feel like. Good. And this is what dull is going to feel like. Perfect. So I'm going to have you close your eyes and tell me if you feel sharp or dull. Dull. Good. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Perfect. Okay. Have you noticed any changes in your vision? Okay. Did any doctor tell you that you have color deficiency? No. Okay. So I'm going to start with some light tests. Go ahead and let's see, I think this one is good. Okay, so I'm gonna have you look straight at my nose. I'm gonna shine a bright light in your eyes. Good. Keep on looking at the light. And now look at my nose. Good. Now look at the light. And look at my nose again. Now look at the light. Tell me when you don't see the light anymore. Now, good. Okay, tell me when you don't see the light anymore. Now, good. Alright, go ahead and keep on looking at my nose. I'm going to shine the bright light in your eyes again. Okay. Now, keep on looking at my light. Good. And now look at my nose. And now look at the light again. And now look at my nose. And now look at the light again. And now look at my nose. Good. And now look right here behind it. Right here where I'm showing you. Good. And now look at the light. Okay. And now look behind me again. I'm going to shine the bright light in your eyes. Don't let yourself distracted. Good. Good. And now look at the light. Good. Okay. Can you please follow the light with your eyes only? Don't move your head. You're doing great. Keep on looking in the light. Now go ahead and tell me when you see my fingers in your field of vision. Now, good. Go ahead and tell me when you see my fingers in your field of vision. Now, good. Go ahead and tell me when you see my fingers in your field of vision. Now, good. Same thing. Go ahead and tell me when you see my fingers in your field of vision. Now, good. Go ahead and tell me again when you see my fingers in your field of vision. Now, okay. A little bit of a delayed response there. I wish you were a little bit faster. And okay, I'm going to press my hand right here on your left cheek. And now I need you to look towards my hand right here. Good. Let's go ahead and check your eyes with the light. Good. So keep on looking towards my hand. Okay, keep on looking, keep on looking, keep on looking. Good. Now I'm going to do the same thing, so go ahead and look right here. Okay. Keep on looking, keep on looking. Okay, I'm going to cover one eye at a time. In the meanwhile, I'm going to need you to focus on my nose, okay? Very good. You're doing great. Okay, so let's go ahead and cover one eye. Go ahead and look at my nose. And now I'm going to shift and cover your other eye. Keep on looking at my nose. You're doing great. Keep on looking at my nose. Good. Perfect. Keep on looking at my nose. Okay. So I'm not noticing any rhythmic changes in your vision, but I'll keep on doing this test just to make sure that I'm not losing focus here. So go ahead and you try to focus on my eyes, and I'm going to try to focus on yours and make sure that we're evaluating your vision properly. Good. 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 Perfect. Okay. Can you please tell me what color this is? Let's go ahead and remove these. Okay. Can you please tell me what color this is? Yellow. And what color is this? Green. Perfect. So I'm gonna have you follow the yellow ball with your eyes only. Don't move your head. Keep on looking at the yellow color. And not my gloves, just the yellow ball. Good. Good. And now I'm gonna need you to focus on the green. Don't let yourself distracted by the yellow ball. Keep on focusing on the green ball. Okay, and I'm going to need you to tell me when you don't see the green ball in your field of vision. Now, good. Now. 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 Okay, and same thing. Tell me when you don't see the green ball in your field of vision. Now, good. Now, good. Now, good. Now, perfect. Now. Excellent. Okay, I'm going to check your optic nerve. So for this, I'm going to have you look straight behind me at the wall if you can, and I'm going to come very, very close to your eye. So go ahead and try to keep your eyes as open as you can while I'm doing this. Optic nerve is intact, and I am not noticing any kind of inflammation or abnormality here. That's good. No redness, no scratches. Okay, so I'm going to do the same thing on the other side. Now I'm going to have you focus again behind me, straight at the wall, and I will examine your other eye. Good. Okay. And I am noticing a little bit of redness behind your retina, but not exactly explaining your symptoms, so let's go ahead and keep on looking. Keep your eyes open as much as you can so I can take a look here. That's good. Okay, look up for me, please. Look down. Good. And now look straight again. Okay. 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 I'm going to go ahead and ask you a few questions now. I need you to identify what you see in each square. So let's go ahead and start with a very simple one. Can you please tell me what you see right here? It's a frog, good. And what do you see here? It's a monkey, good. What about here? A parrot, good. And what does this look like? Cow, good. What about this one? It's a cat, good. And what about here? Rabbit, very good. Okay, can you please tell me what letter this is? W. And what letter is this? T, good. What about this one right here? H, okay. Perfect. Okay, now we're going to check you for color deficiency. Can you please tell me what number this is? 6. And what about this one? 8. Good. Can you please tell me what number this is? 3. And what about this one? 5. Good. Let's go ahead and change the colors. Can you please tell me what number this is? 9. Very good. And what about this one? 2. Excellent. And what number this is? 7. And What number is this? 5. Very good. What number do you see right here? No number? Okay, good. What about here? Do you see any numbers? No. Good. And what about here? Do you see any numbers here? Okay, what about here? Okay, perfect. Okay, I'm going to go ahead and check your ears now. Have you noticed anything abnormal? No. Alright, so I'm going to go ahead and check your tympanic membrane first, and then I will do a hearing and a whisper test, and I have some tuning forks here to make sure that I'm evaluating you for any hearing problems. Okay. Alright, so I'm going to have you turn your head that way for me. Good. Thank you. And can you please take a deep breath in and breathe out. Good. And now swallow it 2 times. So I did not see any vibrations on your tympanic membrane, and it looks very normal color, broad gray. I'm not seeing any redness. There's no signs of infection. Perfect. Alright, so I'm gonna have you now turn this way, and I will examine your right ear. I will have you do the same thing. I'll have you take a deep breath in now and out. And can you please swallow 2 times? And again. Good. And can you please say 99? Good. 33. Good. 66. Good. So I'm not seeing anything. The tympanic membrane is also pearl gray and no vibrations around it, which is a very good sign. Okay, so I'm going to go ahead and examine your hearing now with a tuning fork, and I need you to tell me if you hear a low pitch or a high pitch sound, okay? So is this a low pitch or a high pitch sound? Okay, let's go ahead and check your other ear now. Again, low pitch or high pitch. Good. Okay, now I'm gonna need you to tell me which position here is louder, position number 1 or position number 2. So this is position number 1, and this is position number 2. Definitely number 2. Okay, now I'm going to go ahead and do the same thing on the other side. So, which position here is louder? Position number 1 or position number 2? Number 1. Okay, great. And same thing. I'm going to need you to tell me if you hear a high pitch or a low pitch sound. Definitely a low pitch. Okay, let's go ahead and try that again. Definitely a low pitch. Okay, let's go ahead and perform a whisper test. Have you ever had one done? All right. So I'm going to have you cover one ear, and I will whisper in your other ear some usually numbers I like to do because they're very simple to follow along. Okay, so go ahead and cover your right ear, and I'll whisper in your left ear. 1944. Good, and I'll do the same thing on the other side. Go ahead and cover your left ear now. 1956. Okay, good. Let's go ahead and do that again. 2500. Good. 21506. Good. 2024. 2025. Okay, go ahead and close your eyes now, and I'm going to need you to tell me with which ear you hear this sound. Go ahead and close your eyes. Good. 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 Okay, wonderful. Okay. I'm going to go ahead and check your mouth. Any pain while you open your mouth wide? No. Then I'm going to have you do that, okay? Go ahead and give me a big ah. Good. So uvulus midline, I'm not noticing anything abnormal, no redness. Good. Okay. Can you please stick your tongue out for me? Good. And move it up and down, side to side. Can you stick your tongue inside your cheek? Good. Can you do the same thing on the other side? Okay, perfect. Can you give me a big smile? Good. And now frown. Puff your cheeks. Keep them puffed for me, please. Don't let me unpuff them. Good. And now can you please lift your eyebrows as high as you can? I'm going to try to push them down. Don't let me do that. Good. And now I'm going to have you look this way for me, and I'm going to push on your cheek. So go ahead. Don't let me do that. Resist. Good. And now I'll have you do the same thing. Just look this way, and I'm going to push your cheek again. Don't let me do that. Resist. Good. And I'll have you shrug your shoulders. Good. And can you please squeeze my fingers? Perfect. Okay. So I think we're ready to start not the smell test. Let's go ahead and do taste first, and then we're going to do smell. So what I'm going to do is I'll put one drop on your tongue, and I'm going to have you first describe the taste. Try to use about 2 to 3 words, and then go ahead and tell me what it tastes like. Okay? Go ahead and open your mouth, and one drop. Perfect. So go ahead and first describe it. Use about 2 to 3 words, even 2, I'll take it. Okay, good. And what does it taste like? Cinnamon. Okay, perfect. Let's go ahead and try one more taste. Okay, so I'm going to do the same thing. I'm going to put one drop on your tongue. Can you please stick your tongue out for me? Good, say ah. Perfect. And describe it in about 2 words, 3 words if you can, and tell me what you identify the taste with. Pineapple. Perfect. All right. Let's go ahead and try one more. Okay, so I'm going to put one drop on your tongue. I'm going to have you open your mouth, stick your tongue out. Good. And what does that taste like? Okay, and do you have about 2 words that you could describe it? Alright, perfect. So let's go ahead and check your nose. Okay, I'm going to have you look up. Good. Have you noticed anything abnormal? Any swelling? No, good. Okay, let's go ahead and check your other nostril now. Okay, good. No, I'm not seeing anything abnormal there either. Okay, let's go ahead and just cover one nostril, okay? I'm going to go ahead and just gently press here on one there. Okay, good. Now can you please breathe in, breathe out? Good. And same thing on the other side. Breathe in, breathe out through your nose only. Good. Okay, so both nares are patent. That's good. That means we can go ahead and start our smell test. Alright, let's see. Okay, we're going to start with this smell first. I'm mixing it very well. Make sure that we're getting a good amount. Okay. Okay, so let's go ahead and cover one nostril. Perfect. And I'm going to have you take a deep breath in through your nose and breathe out. And breathe out. Okay. What does that smell like? Strawberries. Okay. Good. Let's go ahead and check one more. And we're going to try this one. And I'm going to have you take a deep breath in. Let's go ahead and cover your other nostril and breathe in, breathe out. Breathe in, breathe out. Good. And what does that smell like? Lavender. Excellent. Alright, so your smell is intact. I'm not worried. Let's go ahead and type all of this down. Okay. Smell intact. Taste. And we're going to go ahead and check in reflexes. Okay. Alright, now I'm going to have you relax your jaw. Good. And I'm going to tap on your jaw. Perfect. And I'm going to tap on your shoulder as well. Good. Elbow. Good. And on your wrist. Good. I'll do the same thing on the other side. So I'll get shoulder. Good. Elbow. Okay, good. Wrist. Okay. And now I'll tap on your knees. Good. Okay. And now I'll check your feet as well. Top of all the examination that we just did, I'm gonna have to do a cognitive evaluation. So I'm going to show you a few cards and I'm gonna need you to describe the feeling. What kind of feeling do you get from looking at a picture? Okay, so let's go ahead and begin with the first one. Can you please describe what does this picture give you? What kind of feeling? Okay. And what do you think they're doing? Okay, that's good. All right, let's go ahead and check the second one. So go ahead and tell me the first word that comes in your mind when you look at this picture. Just the first word, don't even think about it. Good. Okay. First word that comes in your mind when you look at this picture. Okay. Any feelings associated with it? Okay. Alright. I skipped one. Oh, no, that was good. Alright. Go ahead and tell me the first word that comes in your mind. Good. And what about here? First word. Okay. Now go ahead and tell me what kind of feeling does this picture give you? Good. And what do you think they're running towards? Okay, do you think they're running from something? Okay. And tell me what kind of feeling does this picture give you? Okay, good. And do you think they're jumping? Okay, or they're flying? Okay. Let's see, maybe this picture is like this. Perfect. Alright, now tell me when you look at this picture, what's the first word that comes in your mind? Okay. Alright, perfect. Okay, now can you please tell me how many circles you see here? Good. How many circles do you see now? Good. Okay. And can you please look at the light? Good. Look at the light again. Good. And look at the light again. Good. Look at the light again. Good. Keep looking at the light. Okay. Let's go ahead and change the light. Keep looking at the light. And keep looking at the light. And look at the light again. Good. Look at the light. Okay. Follow the light. Good. All right. So I think we finalized today's examination, and that brings me to my conclusion that I need you to refer you to cardiology. So I'm going to see you next time for a cardiology examination, okay? Now, I don't know if you've ever had one done, but we're going to do an EKG, make sure that your heart is functioning properly. Okay, do you have any questions for me? You don't? That's wonderful. Well, thank you so much for allowing me to do this exam on you, and I'll see you back soon. Okay, take care now.